Hello, welcome to Franklin County Home Health Agency's Where the Heart Is. I'm Jennifer Martin, your host for today's show. Franklin County Home Health Agency is a nonprofit home health care organization that has been providing services to people of all ages throughout Franklin County since 1969. We are happy to bring you this show to offer information about the agency's programs and services and to help bring information to help you stay safe and healthy at home. With our aging population growing, it is so important to have quality services in place that help people age at home. Today we'll be talking about Franklin County Home Health Agency's long-term care programs, which aim to help people maintain their dignity and independence while receiving the care and support necessary to help them stay safe and healthy at home. So I have three guests with me today. Thank you guys for being here. Deb Peloubet, registered nurse and one of the long-term care coordinators at Franklin County Home Health, and Mary and Jim Pelkey, community members here, who have had experience with Franklin County Home Health's long-term care program and caring for your mother, Jim. So thank you all for being here, and you can share with us some information about your experience, and Deb can talk to us about the agency's programs and services a little bit more. So I just want to start with a general definition. I gave a little overview, I guess, of long-term care, but if you could define the long-term care program for us, Deb.
Well, basically, it is what we at the agency call is the personal care with type custodial care, the homemaking, the companionship. We provide some respite, but it's basically designed for the client in the home. So, and it's, again, we're there long term.
And your population of people you're providing care to is?
It varies from 18 years of age until into the 80s and 90s.
So adults with disabilities would be the 18?
Well, yes, with care needs.
Okay, good. Thank you, Deb. So Jim and Mary, if you could talk to us about your personal experience and what you could share with us about how you worked with Franklin County Home Health.
Well, of course, I've known about Franklin County Home Health for several years, having been a local, and so I knew what kinds of services you offered. Didn't really affect us personally until my mom, I think early on when she first had her heart attack, and I think, was that 2001, Mary? I think it was.
About 2001, yeah.
She had a heart attack, open heart surgery. At that point, she was getting some limited services. I don't think it was long-term care at that point, but the home health was coming into the home, and the nurse for sure. And later on, she developed congestive heart failure, and she's always had a really debilitating arthritic condition, and that got to the point where she was really unable to go to the bathroom and things like that, and that's when really the long-term care started with. So we knew home health for after her heart attack, and they just increased their services with us over time.
To meet her needs at the time.
Exactly.
Yeah. Now, she was living with you when she started
was.
Services?
She was. Actually, both of our moms are living with us.
Yeah.
They both needed care, and so we were having both living with us on Hoyt Street.
Could you talk a little bit about that, the challenges of having a full house and a lot of care?
That's
necessary?
my wife. My wife could start
Well, it was challenging. It was sort of funny. Before Jim and I got married, when we met and dated, and he was taking care of his mom, and I was taking care of my mom. Most families merge children. Yeah. We merged moms at the time, and we thought, great, they're going to have companionship together. It doesn't always work out that way. My mom sort of stayed in her section, and his mom stayed in her section, but trying to provide both of their needs in a very, the least restrictive way that we could is the challenge that we had. So especially when my mom wasn't receiving home health services at the time, but especially when his mom decided that she was ready to accept more help. And that was a very, very difficult decision for her. But we were seeing that we were like up until 12, 1 o'clock some mornings, and then we'd, some nights, and then we'd get up and go to work in the morning and rush home at lunchtime, and she would need more and more of our time and services, and that's when we realized we were going to need some help.
Yes.
And being lucky that we live in a community that has home health services, we were able to find out more information and get the paperwork. Oh God, thanks, Deb. People out there, if you're thinking about it, ask questions, and I think that's the biggest thing. It's not something you can just jump into and say, okay, this is what's going to happen. Have somebody come at 6 o'clock tomorrow night and off we go. There does take some planning, and it's important for the comfort of the caregivers as well as for the person receiving the care that everybody's comfortable. And you were great when we did the paperwork and the questions and, you know, what is she eligible for and how many hours and what does it mean to us?
And, you know, it's, of course, we both had to work. I mean,
Yeah.
you know, we needed both incomes in the home, so we really couldn't be home to be her caretaker. And, you know, she didn't need somebody initially 24/7. When we were working in town, we both work in town, if she needed us when home health wasn't there, they could, she could call us and one of us could get home.
Yeah.
But when we went away on a vacation,
Yeah, talk about that a little bit.
well, when we went away,
Vacation time. Going
A lot
away.
of forethought,
a lot.
and a lot of planning.
We would start, what, 6 months at least ahead of time when we knew we were going to be on vacation.
Yeah, with the date that you would be leaving, or when you were planning to take your vacation.
Right.
We would start preparing, and again, because this here was depending on what type of, how long they chose to be away, could be from 7 to 9 days that we provided care to Jim's mom, and that was basically, you know, 24/7. And again, the program that she was on did allow for that respite type care. So again, with careful planning from Mary and Jim and our staff, you know, again, we were able, the first year, you know, we were all kind of on pins and needles to see how well this would go. But then the second year, Jim's mom called it her vacation. I think she was more excited than Jim and Mary about them leaving. She would have the house to herself.
And have 24/7
care.
somebody
Attention.
just for her.
Yeah, that's
Again,
lovely.
and again, yes, because Jim and Mary do work,
Yeah.
so they would be out of the home, and our staff would provide some supplemental time in the home, but not that constant
And that's
care.
normal, though, just to clarify
That
that,
is
this
the
was a special
typical.
situation where you were taking
Yep.
vacation, and the program she was enrolled in did allow for that specific time to have full coverage, if you will. But normally, you were there supplementing care that while you guys were working could get done.
she had a caretaker to help her bathe and dress 3 days a week,
Yeah,
about
and
an
that
hour or
was
so at
through
a
our-
time.
Through our home care
home.
program.
Right, and then she had a homemaker that came in and helped her with various things on 2 days a week. And I think you tried to stagger those so that when the caregiver was not there, I was there on Monday, the homemaker came on Tuesday, and
Yes.
so she had somebody there 5 days a
Yes.
week,
So
There's
which
a
is
lot
really
of attention
nice.
paid to meeting your needs. You picked up this paper when you were talking about
Well-
vacation. Can you talk about what kind of things are in there? What made it unique?
Well, what was really, the first time we went away, it was really scary because we were feeling, not that we didn't trust, you know, home health, but I think it's just normal to worry, oh, she's going to complain, she's not going to like how they make her oatmeal, or she's going to be disappointed. Well, we decided the second year when we were going to write from 7:30 in the morning when she gets up till she goes to bed. We did breakfast and lunch and dinner, what time she liked to go to bed, where she liked to sit when she got ready for bed. And all those little details, I think that's why she considered it a vacation after that, because we did take care of the details. And I have to admit, I think the staff enjoyed it. We had it in a binder, and if somebody had to fill in at the last minute, they could just look at the binder and they didn't have to worry about what goes on right now. When does she take, oh, she takes her own meds, oh, then we don't have to worry about that.
And that's important. You had those very important details about medication and self or care and whatnot, but those little things about how she likes oatmeal and stuff, I think is so important in this type of work because it's her home environment. So when we're going into someone's home, those things matter. You know?
And, you know, and, I'm sorry.
No, I was going to say they were great about bringing the workers in to meet with us and with my mother-in-law prior to us leaving. And sometimes we would have them come like through lunchtime or through the mealtime or through setting up to brush her teeth. Now that might seem like just a very normal everyday activity for all of us, but when you're depending on somebody to bring you the things and you usually like the napkins here, the cup of water here, the toothbrush here and that, you know, it gets you off balance if somebody comes in and doesn't have all of that. So they watched how we set it up. I think we even wrote you know,
Yes.
what side of the table she likes the water. I mean, we might have gone a little overboard, but you know, but okay, I got a little detailed. But you know, but when we came back, she wasn't. It wasn't. Oh, and they didn't do this, and they didn't set up this
Sure.
right, and they didn't do that. It was like she considered the workers her friends.
Yes.
And how wonderful. I hope you enjoyed your vacation too, because you do need that respite time.
We didn't have, we were able to enjoy our vacation without worrying, and
Yeah.
that was the main thing.
And
that
that
was
would-
so priceless with you guys around, you know, so.
That's what I would encourage people to do, to ask questions, take advantage. I don't think the first couple years we were married, we took advantage of the respite time as often as we should until I think you were one of the ones that said, look, it's there. You need some time. You have both moms. My mom, since I mentioned she was living with us too, she usually went to visit another sister or a relative or a friend during that time. So we had those plans to make too.
Tell you, Jen, poor Deb, I bugged her to death on the telephone. It got to the point where I'd call up and they'd say, oh, it's Jim Pelkey, and he had to answer who I was. What can we do for you now? You need Deb, right? Yep.
Yeah. Well, that's the thing. A
Well,
phone call away.
And again, and that was just a show too. Again, there was couple times there was a special need that, you know, again,
Right.
Jim needed, you know, he had to be away from the home and he knew that he could not, you know, again, do the meal. But again, we already had a knowledge base with her. Her vacation, but again, we were able to just go in and say, you know, Jim, go do what you need to do, and the staff knew her, so again, they were very comfortable. So we were able to, you know, put together a schedule so that again, Jim and Mary could do what needed to be done and just return home.
It's a great, thank you for sharing that experience. It's a great thing for folks to hear that when you do have someone at home with you, you don't have to do it all. There is support for you. If, you know, the call, check about the eligibility, see what programs are there for them to help the individual and the family caring for them. And then for people who maybe are out of state or having the same worries that you are when you're on vacation, are they taking care of mom that way, or is she happy? So I think it's great that you shared that experience.
As time went on, the phone calls to check on her got
Yeah.
fewer and fewer in between as the comfort got more comfortable.
She had some folks that had been there from year to year.
She did.
In
Yes,
fact,
she
she
did.
had some that actually, I think asked Deb if they could sign on for that vacation.
Yes, they did.
My mom liked to talk.
Yeah.
She definitely talked.
But it was you know, home health. Made it feel like home, and that's the important thing, that the people that are receiving the services don't feel like their home is being invaded.
Absolutely. Dignity and independence is in your home.
We had our own side of the house too, so you know, we told the workers, you know, use the living room, use the television. We had 2 refrigerators full of snacks and drinks, and help yourself, and you know, so they could feel that like they were home while they were there helping mom too.
Very
So
nice. Yeah.
it's always nice to do. So.
Good. Thank you for sharing. We'll get back to a little bit more of your story. I want to talk, Deb, again about the specific programs that fall under long-term care. Can you talk about the differences in the...
We have different levels of programs for the customers or consumers that are here in Franklin County. We have a homemaker program where, again, we just provide some light housekeeping, meal preparation, laundry, just home environmental upkeep, or, you know, the day-to-day type stuff. And then we also have a CareNet service where, again, some people choose to pay privately for care. They may have had home care and they're now transitioning back to more independence, but again, some people feel that, you know, again, I want my LNA, or I would like just a little bit more assistance, so they'll transition to our CareNet program. And again, that is, you know, fee for service. And with that, they also receive the light housekeeping, meal prep. They may have some assistance with personal care. If they're on a home exercise program, that is followed through with. And also with CareNet, we do provide transportation to doctor's appointments. But there is we do charge for the IRS mileage. So again, just to note that. And again, if someone wants to go shopping, you know, again, if we want to help maintain their independence, and
So if they can get out of the home safely with somebody with them driving, then...
Yep. So again, that's part of it. Then we have the long-term care Medicaid home-based waiver program, and that's, I think, where we draw our name, long-term care department, from. And that's a program that's subsidized by Medicaid. It is, you have to meet the financial criteria, and then also what they call the clinical criteria. So again, there's a component to that, and it does take a little bit of time for the process to go forward and be completed, and someone, when found eligible for both financial and clinical care, you know, again, they come onto the program, and we provide care attendance for that. So, and as
Now,
I
you
say,
mentioned, so the long-term care is a Medicaid, provides payment for that. The CareNet is private pay, and then the homemaker piece, can you talk about that funding?
and that can be supported through United Way, and there are some public funding that's available. Again, the best bet is just to call our office. Let me know what your care needs are, and then we can go from there, help steer you in the right direction.
There's a lot to think about. So if you're at home hearing all these, you might seem overwhelmed, but Deb and your other staff,
My team members,
your
yes.
team members will help walk you through the right place and
Yeah.
find the care that can help you at home.
Yes,
Sure. Okay.
yes.
Thank you. Could you talk about, let's just back up a little bit again, what do you think would have happened if this wasn't in our community? How would that have changed your life?
Oh, yeah. One of us would have probably had to stop working, and it would have changed our life significantly.
And it may have changed being able to stay in the home, which was handicap accessible, because we did need 2 incomes to be able to maintain the home. So if one of us had to stay home to give the care, that would have changed the whole dynamic of the home.
Right, exactly. So, and then going to nursing homes or other care is adding another burden on our healthcare society as well. So as much as possible, if you can keep someone home when you can, we're glad to be there for that. Good.
And we were able to do that with your assistance, which is wonderful.
Wonderful. How, you said call the agency about questions, so that's how folks get started. Call the agency, talk with the doctor, talk with other people. You may have services in our community. Can you talk about other agencies in our community that we collaborate with that might help people get to this point when they need services?
Yes, we have. I have frequent communication with our area agency on aging. They are very instrumental also in helping to find resources for some of our clients. So, and again, we also have our home care program, which it's all. Care is delivered under the direction of a physician. So again, that's also a resource for us, because again, if someone is transitioning and not quite ready.
And like in your situation, you were receiving home care that noticed you could use.
Exactly.
Sure, so it's seamless.
And then transitioned on to more of the
long-term care.
Okay.
So.
How about our care attendants you mentioned? How are staff hired? What's the process for background checks? What's the benefit of going through a service like Franklin County Home Health?
Well, again, we receive applications for employment, so then we go through and look for what we hope are good candidates to come into our agency, and then an interview is set up, and we meet with the potential staff person. We have certain questions that we ask just to glean if they're going to be a fit for our agency. And then from there, we do a condition of offer of work, and they know that they have to complete a background check before they are officially hired. And then from there, we actually have a 2-day orientation where they learn the policies of the agency, the care, and what we look for are staff who are comfortable with personal care, because again, that is a component of what we do. So again, and then also the other piece, because it's winter time, we also, right now the question is how comfortable are you traveling on these winter roads?
And we go through the 15 cities and towns of Franklin County. So you may be local or you may be out a little further. So you're looking for people all over the county.
We're looking for people all over the county. And again, we are under contract with these families that, we're saying we have staff for you. So again,
reliability
is, again, that's probably the key piece, is that, again, we need to deliver care that we said we are going to. So.
Are we currently hiring? What's the?
We are currently hiring. Actually, our again, we have clients who are waiting to come on service with us, and we like to meet the needs that that come to us. So again, we are hiring, definitely hiring.
Oh, good. So if you're looking for something like this to help, really meaningful work to help people stay safe and healthy at home as they age, it's really a rewarding job. So if folks are interested, they can call the office and ask for an application. Is
Yes.
that right? Okay, good. Excuse me. I think we've covered a lot of what I had. I wanted to ask you guys if we've had anything you'd like to share that didn't come up already, Deb or Jim and Mary.
I think you do a great job at interviewing, because the people that took care of Mom, you could tell they really liked what they were doing and they wanted to be there. And that means a lot to the people that are receiving the services as well as the caregivers.
Yeah.
I don't think just anybody can be a caregiver. I think it takes a special person, and I think you had a staff full of very special people, and
I'll tell you
work with that.
a nice little story. I mean, sometimes you just are so appreciative of the staff coming in. We got back from the last vacation I think we went on, and there was a thank you note from one of your staff.
Oh.
And I was reading it, and they said, "Thank you so much for letting us come and spend this time, with your mom." And I read it, and I said, "Wow, they're thanking us." So it made me feel like she made Mom feel really comfortable, and had that little note sitting there, waiting when we got home from vacation. And so that's, that's just a nice touch, and it just means a lot.
Yeah. I think another thing, like you mentioned with this vacation, you had to find a lot of staff. So the beauty of having a roster of staff available through home health, many folks might have a neighbor, somebody who could watch their aging mom at times, and that's wonderful. We're a tight community, and it's good to do that. But how great it is to be part of a program where if one of those people did become sick, because that does happen too, that you have someone to call on to fill in so that you did know it would be covered. So there's a benefit of using an agency.
Perfect thing that happened is the first time, if there was, because she could stay alone for an hour or so, but then there was the fear, what happened if somebody got stuck on the road or an accident, and there wasn't that changing of the guards, so to speak. So then the comfort of having the 24/7 the last few times we had to leave, before Mom passed away, it was really wonderful, because we didn't have to worry. We knew if somebody was late, the other staff person was going to stay until the next
not leave
person
her
came
alone.
on. So
Exactly.
the comfort level was wonderful.
That's great.
Agree.
Good. Thank you. And Deb, anything else you'd like to share before we close?
Well, the sad part is the passing of the client, again, disrupts our relationship.
Yeah. Yeah.
But we've lost both our moms now in the last couple of years, but I would highly encourage people that are worried about it to really get in touch with home health and take advantage of the wonderful service.
If anybody wants to know about our experiences and our recommendation, they can contact us anytime.
Wonderful. Thank you. You're both here in our community, and I thank you both for everything that you do in Franklin County. Mary, you've spent many years with the foster grandparents.
It's my 25th year.
Yes.
Yeah.
So wonderful. That's special work as well.
Thank you so much.
So thank you both, and thank you for being here and sharing your story
Thank you.
about your mothers, and thank you for taking care of them as well. It was working together with our team at Home Health. And
Thank you for
Right,
being
it's a team.
with us.
It's a team effort.
yeah.
The family, the client, and us.
Yes, that's
And it
right.
worked.
Absolutely. Thank you, Deb.
Thanks.
So we hope if you're watching and you have any questions about long-term care or other ways that Franklin County Home Health can help you or a loved one stay safe and healthy at home, please call the office Monday through Friday at 527-7531. Thank you for watching today. Be well.